So in this video, we are going to talk about movement disorders. So the movement disorders are when there is a lesion in any of the structures that are mostly associated with movement, such as the basal ganglia or the cerebellum, etc. And sometimes it can be due to some muscle dysfunctions. So the first one we are going to talk about is akathisia. Akathisia is a restlessness and intense urge to move. It is a side effect of many drugs such as the neuroleptics or the anti-Parkinson drugs. It is mostly a side effect of antipsychotic drugs. And it is seen in 5% of people who take these drugs or any drugs. The feeling of restlessness and intense urge to move. So you do anything, like you walk around, you move your hands, you move your legs continuously because you have the urge to move. The second one is Asterixis. Asterixis is also called flapping tremor. As you can see, the patient's wrists are extended and the doctor tries to extend them more. The patient flaps his hands in the front. It is mostly associated with hepatic encephalopathy, Wilson's disease, and other metabolic disorders. The third one is athetosis. Athetosis is a slow snake-like writhing movements, especially seen in the fingers. As you can see here, it is a slow snake-like movement, especially seen in the fingers, and it happens when there is a lesion in the basal ganglia. The fourth one is chorea. Chorea, it is a sudden, jerky, purposeless movements. So even when you're sitting straight, you have these jerky, purposeless movements, something like you're dancing out of nowhere. And chorea seen in Huntington's disease is called Huntington's chorea, whereas the chorea seen in acute rheumatic fever is called Sydenham chorea. Dystonia, the fifth one. Dystonia is a sustained involuntary muscle contraction. So dystonia, abnormal tone of the muscles. So any muscle in your body, it gets sustained and it changes your position into a painful one. It becomes so stiff that it is we are unable to move, we are unable to shift the position of that muscle. It is seen in writer's cramp, where you can see the person is writing something and all of a sudden he's unable to write anymore. The speed becomes slow and the letters become messy. Blepharospasm, where you can see an involuntary tightening of the eyes, and because of that tightening he is unable to open the eyes completely. And then torticollis. Torticollis means twisted neck. In this you can see the patient has a stiff neck towards one side. He tries to shift the neck into the proper normal position. He feels pain on the opposite side. That stiff neck is called torticollis. The sixth one is essential tremor. It is also called postural tremor. It is a high frequency tremor with sustained posture. Example, outstretched arms worsen with movement or when anxious. As you can see, there is a clear tremor in this video. And it happens to him especially when he's trying to do some work, like when he's trying to drink from a bottle or when he's trying to put up a posture. This is mostly familial. Patients often self-medicate with alcohol because alcohol decreases the amplitude of this tremor. The main treatment is non-selective beta blockers. It blocks the nerve impulses to these muscles, the muscles that are causing the essential tremors. Then comes hemibalasmus. In hemibalasmus, you can see sudden wild flailing or wave-like movement of only one arm and one leg, both on one side. And the lesion is in contralateral subthalamic nucleus. As you can see here, the patient is showing wave-like movements or sudden abnormal movements on one side of both upper and lower extremities. Then comes intentional tremor. Intentional tremor is when there is a problem with the cerebellum. Slow zigzag motion when pointing or extending towards a target. So here when the patient is trying to press the button of the object, he starts having a tremor. That is, when he's trying to intentionally do something, the tremor occurs. This is called intentional tremor. And then myoclonus. Myoclonus, it leads to dystonia. So myoclonus is it is a sudden, brief, uncontrolled muscle contraction, like jerks or hiccups, etc. And as you can see here, the lady, she's listening to some music and suddenly she has a jerk. That is called a myoclonic jerk. And then resting tremor. Resting tremor is one of the main symptoms of Parkinson's disease. It occurs at rest and it is also called pill rolling tremor. As you know, Parkinson's disease happens when there is decreased dopamine because there is a lesion in substantia nigra. So uncontrolled movement of distal appendages, especially the hands, tremor alleviated by intentional movement. And the last one, restless leg syndrome. 1 in 50 kids have this syndrome. It is an uncontrolled movement of legs, especially which are worse at rest or nighttime, and they are relieved by movement. This is mostly associated with iron deficiency because iron, it helps in the production of dopamine. Since there is a deficiency in iron, dopamine also decreases. It is also associated with chronic kidney disease and it is treated with dopamine agonists. So this is all about the movement disorders. Thank you.